Hi guys, Dr. Elizabeth Yurth from Boulder Longevity Institute and Human Optimization Academy. So welcome to another one of our just little mini lectures. This is going to be just a little 10-minute lecture, and I've talked about this a billion times before, and I know there's other things posted already about this, but it is still the biggest concern and the biggest question I get from our patients is hormones cause cancer. I don't want to do hormones. They're bad for me. My doctor told me I can't do hormones because they cause cancer. I have a family history of breast cancer. And I just want to once again go through this process to explain to you where this myth came from and why it's been disproven, and yet we're still not there with recommending this very important therapy for people that that is life-saving in terms of your brain and your heart and your bones and just longevity. So I'm going to run through it quickly one more time, just so you guys hopefully get reassured that hormones are not the cause of cancer. So where did this sort of theory come from? It really came from a giant study called the Women's Health Initiative Study. And it was started in 1991 as part of the NIH initiative to really, kind of help postmenopausal women and look at diseases that they die from and hopefully try and prevent that. And it was a huge study. It involved more than 160,000 postmenopausal women, ages 50 to 79, who participated in the study. So it was really the largest preventive study ever done in the United States on women. And they followed these women for quite a number of years, and they then posted results in 2002 that showed that women taking combination hormone pills with estrogen and progestin, that's important. So they were on Premarin, which is estrogen and progestin hormone therapy, had an increased risk of breast cancer, heart disease, strokes, blood clots. They did show they had a lower risk of fractures and a lower risk of colorectal cancer, but they said that those benefits did not outweigh the risks. And they said all women should stop their hormone replacement immediately. There were so many flaws in this study and in its reporting that even the authors came back and said that a lot of the data had been misinterpreted. In fact, in that data, when they pulled out the women who are just on estrogen, not on Premarin or progestin with their estrogen, they did not have the increased risk. In fact, they had a reduced risk of cancers and a reduced risk of heart disease. So the study initially was flawed from the beginning, too, because of the women they chose for the study. So they chose women who had not just your typical females who are kind of walking around, but they chose women from a large age group, most of who had other comorbidities, meaning a lot who were smokers, because a lot of women who at this time were women who they were symptomatic from menopause, and so a lot of them had other issues. They didn't exercise, they were obese, they were smokers. So a large number of the women who were involved in the study had a lot of comorbidities as well, and that probably played a role in some of the outcomes as well. What didn't get published was the data that followed after the Women's Health Initiative. So 2002, so now 20 years ago, right, we make this recommendation, stop all hormones. And we then fail to even look at the newer data coming out, and that that there's other studies that have been done that now have disproven the Women's Health Initiative study. And as I said, even their own authors said, hey, there was some misinterpretations in the study. But this was a huge study that came out in 2021. And they really looked at a 20-year follow-up after the Women's Health Initiative study. And what they found is that there was a lower breast cancer mortality in women with estrogen alone. And there was no difference in breast cancer mortality with women with estrogen plus progesterone. And this was with oral estrogens, which are not the best way of administering estrogens anyway. So this cumulative 20-year follow-up report of the same patient's data showed that if you took progestin out of the mix, then none of those risks occurred. So instead of saying, oh, we need to not use progestin, we actually just said stop using hormones. The reason progestins are so dangerous is because they are not progesterone. And in fact, they are a synthetic that doesn't even fit in the progesterone receptor. It has a similar effect on the uterus, to keep the uterine lining stabilized, but it does not affect all the other things that progesterone does, like the immune cells, like the brain, like helping with anxiety, like blood pressure, like fluid retention. Progesterones are very, very different than progestins. So when they took this study out and they looked at benefit versus risk, and this is again with oral estrogens, okay, and we do not use oral estrogens, and I'll explain that in a minute, but this was with estrogens and, again, progestins, you can see that the only thing that came up in the risk category when you had estrogen alone, so estrogen alone, was coronary heart disease, and that has to do with the fact that oral estrogens do create thromboembolic events. So oral estrogens will increase coronary heart disease. Oral estrogens will increase the risk of strokes. Oral estrogens will increase the risk of venous thromboembolism. So basically, when you looked at the benefits, they still outweighed the risks. I mean, look at the benefit, and this is, again, with even the progestin involved. Fractures were lower. Colon cancer was lower. Endometrial cancer was lower. Breast cancer with estrogen alone was lower. The risk was increased when you added progestins. All-cause mortality from anything was equal, whether you were on estrogen, progestin, or nothings. And then again, the thromboembolic events were higher. With either estrogen and progestin, we saw a reduction in risk of type 2 diabetes. And what's not in here as well is the brain effects, because we also know there's a reduction in risk of Alzheimer's. And if that's not enough for you, how about modern day, where we're all trying to not get COVID, or not get COVID for the third or fourth time? If women are on hormone replacement, there's a significant lower risk of COVID-19 mortality. This is a study, again, more recent study, came out in 2013. So this is a huge follow-up of hormone replacement after breast cancer done, and it's what's called the Stockholm trial. And what they found was that the number of new events did not differ significantly between groups in contrast to all previous reports. And the increased recurrence had been attributed to higher progestin exposure. Okay? Again, progestin, the culprit. Here's a study that just came out in the Cancer Journal, so a pretty reputable journal for all you cancer doctors, in May of 2022. And this is actually looking at hormone replacement even after breast cancer, which is an area that, that everybody gets really nervous about. And they looked at decades of evidence to support the reproducible benefits of hormone replacement for symptom control, for cardiac health, for prevention of fractures, for reduction in the risk of cognitive decline, for enhanced longevity. It quantifies the increased risk of thromboembolism, again, that's oral estrogens, associated with oral, though not transdermal, hormone replacement therapy. Evaluates repeated claims that hormone therapy is associated with an increased risk of breast cancer development, and when administered to breast cancer survivors, there was no increased risk of recurrence. So 25 studies of hormone replacement therapy after breast cancer diagnosis were published between 1980 and 2013. These were peer-reviewed studies that they felt qualified as really reputable studies. Only one of the 25 studies, and this was called the Habits trial, demonstrated any kind of risk of recurrence. And that was limited to local or contralateral and not any distant recurrence. And again, that was a study where that was with progestin. When they took the progestin out, that did not exist. None of the studies showed any increased risk of mortality or metastasis. And even the Habit study, again, showed it only with estrogen and progestin. So it's on the basis of so basically the only increase they saw in the number of women who had a recurrence, localized only, and this was out of almost 1 million patients. There was 22 patients in the Habit study that localized recurrence, 22. And it was based on that 22 patients that they said we shouldn't actually do hormone replacement in breast cancer patients. This is a study that just came out in July. So these are recent studies, guys. You have to look at the new data. Study came out in July, and it showed that postmenopausal women treated for early stage estrogen receptor positive breast cancer, neither vaginal estrogen therapy nor any menopausal hormone therapy was associated with any increased risk of recurrence or mortality. This just came out, Journal of National Cancer Institute, July of 2022. Not sure anybody's paying attention, but the studies are out there to support that we can safely use hormone replacement even in breast cancer patients. How about prostate cancer and testosterone? Another area. Millions of men being denied testosterone therapy because they've had prostate cancer. And again, this is in the urology journals, a reputable journal followed by urologists. And they found that there was a 33% reduction in prostate cancer incidence in men with increased testosterone use. They said the mechanism of the protective effects are unclear, but they challenge the current paradigm. How about in the setting of prostate cancer? So the longstanding dogma of the deleterious effects of testosterone replacement therapy has now been challenged, and it appears that testosterone replacement therapy may have an important therapeutic role in men with either low-risk, active, or previously treated prostate cancer. This came out January 2021, okay? So this review looked at 25 years of research and could not find a reason that we should not be treating men with a history of prostate cancer or potentially even active prostate cancer with testosterone therapy. So I think the problem is that when medicine makes a decision on something, it's very, very hard to change that decision. People are reluctant. If it's been working until now, we don't really want to change it up. We don't know. And when you have data and data accumulating to show you that you were wrong, you have to be not afraid to admit that you were wrong and that there might be a better way of doing things. So at this stage in the game, our recommendation is that hormone therapy is very, very safe and life-saving. Your best way to avoid dementia, Alzheimer's, all types of cognitive decline are with hormone replacement, testosterone, estrogen, progesterone. Your best way of keeping muscle mass, keeping libido, being able to hike 14ers at the age of 100 is hormone replacement. If you fall and fracture your hip, you have a likelihood, 50% likelihood within the next 10 years of dying. So we know that these are really bad diseases that we can prevent with hormone replacement. And because of a flawed study that came out 20 years ago, we continue to deny these treatments. I do not think you can age healthily without making sure that you give back the body what it needs to survive. So I hope you guys will take that to heart. I hope I can reassure you a little bit more that the data continues to mount, even within the cancer journals, the urology journals, that the way we've been doing things is not right for our patients. And we need to have an open mind to change. Thanks for listening to this. And again, pass it on.